before I begin, I just want to share with you a little bit about who we are and why you might consider working with an organization like Dublin Health and Benefit. We take a very holistic approach to helping you understand Medicare, individual health, group health insurance, if that's your situation. And we'll speak to all of the solutions that are available to you, whether we actually will, be the one to sell you a product or not. We will help you understand the aerial picture of what your options are. We have 12 employees here that all work pretty closely with over 8,000 clients we have right now. And there's a little blurb about each one of us and who we are and what we do. So if you want to learn more, I'm not going to bore you to death with all the details, but I would encourage you to go to dublinhealth.net to understand our philosophy and approach to working with clients. You can look at individual, international travel insurance, individual health insurance, Medicare options, generally what our services are all about. The good news is we don't charge a fee for working with us. We're compensated by a carrier when you place a piece of business through our office. So we're happy to educate you, whether it's 6 months, 3 weeks, 2 years before you retire. We will take the time to educate you, knowing that with that foundation of relationship, we'll be able to work together as you move forward into a time of change where a product we might offer could work in your situation. So that's a little bit of an overview about who Dublin Health and Benefit is. Our services are free. We always joke there's 20 ways to hang yourself doing this on your own. An example I often use is I had an 85-year-old come into my office who was married to a woman who was 20 years younger than he was, who had employee benefits. And this 85-year-old assumed that he would be penalized if he did not come on to Medicare when he turned 65. So he signed up for Part A and B. The cost of today is about $165 a month to be on Part B. His wife worked for a large corporation where the group benefits were primary, and it was unnecessary for him to have Part B. And yet he paid for it for 20 years. We calculated it cost him $35,000 unnecessarily. And to top it off, when he walked into our office, his 6-month window to buy a supplement had closed, and he needed to qualify medically in order to buy a supplement. So that ship had sailed, needless to say, 19 and a half years ago. So not only was he in the hole 35,000, but he couldn't even buy the product he wanted. So that's just one example of the 20 ways to hang yourself by doing this by yourself. So we encourage you, don't do it yourself. You can do it for yourself, but not by yourself. We're happy to come alongside you and advise you, and whatever you decide you want, we'll help you execute it, and the carrier will compensate us. The rates are the same whether you work with my office. We don't charge a fee, and we don't alter the rate. It's the same rate posted at the New Hampshire Health Insurance Department website. So that's a little bit of an overview about who we are there.